Good morning, Enid. I'm Mayor George Pankonin, Mayor of Enid, Oklahoma. I'm sure you've been following the constantly evolving information regarding the coronavirus pandemic. Your commissioners, the city manager, and I are continually evaluating events as they unfold, as well as the actions taken by President Trump, Governor Stitt, and the mayors from other Oklahoma cities. We have faced many challenges before, including natural disasters such as ice storms, earthquakes, and of course tornadoes, as well as others. We've also survived and flourished after other major events, not the least of which included oil busts. We are survivors. We made it through all these challenges because we care about each other. This challenge is no different. We need to minimize our personal contacts with each other to prevent the spread of this virus. For now, not going to our favorite restaurant for a leisurely meal with extended family and everyone else's extended family. Rather order your meal to go and take it home and share it with your family at the table. Engage your families in the solitude of your home with activities like jigsaw puzzles, board games, and for the younger folks in the household, maybe we can help them with some electronic games. But it's all good. Spend some good family time together. We need to also come together, as we always have, to help our neighbors. There are opportunities like delivering meals to the elderly in our community. I encourage you to find ways to help others in our community, enjoying the safety suggestions like personal distance and group size limitations. This is a challenge that will undoubtedly cause us discomfort in the short term. But arm in arm, we will support each other and see a healthy environment on the other side. So I'm asking for your support and all the things that we're doing. We want to make sure the communication lines stay open with all of you. So we plan on having this segment and talking to you every morning at 10:30, at least Monday through Friday for now, and we'll figure out how to communicate on weekends as well. We're going to have different hosts coming in to help us. We may ask the Garfield County Health Department to come in on some days. As we see questions that are going one way or another, we'll try to call in the expert from that area to join us in our sessions. But we want to be open and provide as much information as we can about what's going on and keep everybody in the loop. Joining me this morning is City Manager Jerald Gilbert and our communications representative, Derek. So we're going to take some questions now. Jerald, did you have anything else you wanted to start with?
Well, thank you, Mayor. It's good to be here with you and Derek to speak with everybody that's out there watching right now. Just to give you a quick update, just to follow up on what the Mayor said. We did do an update yesterday and in the press release that hopefully you've seen and we can talk about today. We're out of an abundance of caution with the increasing crisis with COVID-19. We've closed the admin building to the public, the Stride Bank Center, the Senior Center, and RSVP. We want to stress that Mobile Meals is going on. We appreciate the work of Christy Baker and her team in that organization, and CDSA, who is helping with volunteers to help continue to deliver those meals. The Mayor touched on that. We can use help in that area if you have time. But I wanted to just, and I'm sure there'll be a lot of questions about how we'll be able to do certain things with the admin building in particular closed. We've already closed the Service Center, Champion Gym, and organized activities in the park. So we'll talk about that while we're here. We also want to make sure that everybody knows that the city has also put out that following CDC and State Department of Health guidelines, that organized activities of 10 or more people should not be happening. That should be canceled or postponed during the time of this emergency. And the particular declaration that the Mayor has signed goes through April 13th, but depending on conditions, we'll see what happens.
Good.
Well, there are a few questions out there online, and we have some that we've compiled together. So we're going to get into some of these questions for the viewers. Someone was concerned about the businesses that are having larger groups of employees over the 10 limit, and they were asking what plans do we have for that.
Okay. Businesses right now most businesses are being pretty responsible in the way they do it. And while there may be a large number of employees, if they're not in close proximity to each other, that's probably less a problem than otherwise. but we have not to this point decided to go business by business to try and determine for the business what they need to do. If that does become an issue as time goes on, we'll have to readdress that and probably expand that. But right now, we're just trying to keep the social distance concerns in everybody's mind, including the businesses that are in town. Because certainly, if you have a business and you're distributing products, if those products become contaminated, that becomes an issue for you as well. So I think companies are going to be responsible in the way that they're doing that, not only for the health of their employees, but also for the distribution systems that they're using to be able to distribute their products.
And I would just follow up and add, Mayor, too, that those employees and those concerned companies should take those concerns to management, and typically the big companies have safety directors and safety folks, and I know they're going to, most of them are, following the recommendations of the CDC and the state, just like we are. It's an evolving crisis, so please bring those concerns to your management of your company.
Right.
Okay. There's a question here that someone asked about, will we declare a 2-week mandatory halt on all non-essential retail and food service jobs in the city of Enid? This concern, this young lady says she's concerned with the vulnerable customers, many of them 65 and over.
Right. Well, I think many of the businesses and restaurants already have taken that. I think the first one I seen, I'd like to call out to them because they were the first one I seen, was Chick-fil-A. They closed the dining room, opened up the takeout and encouraged people to do that. And I don't know about you, but it seems to me I've never seen an empty line at the takeout line at Chick-fil-A in Enid. So it's a very popular kind of food, but people are starting to modify their behavior. Instead of sitting down to enjoy dinner in a dining room, they're going, picking it up, bringing it home, and enjoying family time together over their dining table. So are we going to force people to do that? We haven't had to do that yet. We've seen responsible businesses in town already taking the lead on that and doing what they should do.
And I would just say, following state and CDC guidelines again, that that older Americans and folks that are sick or have underlying medical conditions really shouldn't be going out right now. They should stay home. They should stay home at least during the next
Couple weeks.
14 days or so. We're in day 4, I guess, of the 15-day plan from the government. The current citywide declarations through April 13th. So I would encourage those folks to stay home. That will help the situation too. We all have a responsibility here. It's not just the city, the Department of Health, and the state and the federal government. It's all of us as individuals that need to take and follow the appropriate actions. That will really help prevent the spread and flatten the curve, as they say.
Right.
Okay. Here's another question about Wi-Fi. They say, are the city of Enid planning on providing or expanding the citywide Wi-Fi for those people that don't have internet, or that they could have access to information they need?
Well, the city doesn't own the Wi-Fi. It's managed by Altice and Suddenlink here locally. And I do recall seeing recently where Suddenlink has opened up free service for those families that have K through 12 children, or those that are going to college that need to have access to
Good for them.
Wi-Fi to be able to do their schools, participate in school services and activities. I don't know that they've thought about extending that beyond that yet, but I'm sure they will as this evolves, and we can ask them about that. But the point is, I think their initial offer was to provide 60 days of free service to anybody that did not have Wi-Fi service before. At the end of that 60 days, if they wish to continue service, they have a program to be able to do that. But in the meantime, they're trying to help out with that. So I think that'll help quite a bit.
Okay.
Excellent.
There's a question here about quarantining. They say, is there a quarantine shelter for the homeless population if 1 or 2 more need to be in quarantine for 14 days?
Yep.
The city doesn't have a shelter plan for homeless folks. That's an unfortunate situation that we have. We do have several nonprofits here in town who I know are thinking about that particular situation, and some churches. Hope Outreach is one of them, Matt Lohman. Forgotten Ministries with Jeremiah Harrion. I know the Emmanuel Baptist Church is looking at plans to help in that case. And that's a great example of the people and organizations coming together in conjunction with the city and the state and the federal government to help solve this problem.
Okay. Do you have anything? Okay.
Nope, that's good. Yep.
There's another question about getting tested. Some people are wondering why there's so much trouble getting people tested in this area.
Okay. There's a limited number of kits available nationwide. It's not just an Oklahoma problem or an Enid problem for that matter. So they're trying to make sure that the kits are used for those that are truly symptomatic. The trouble is, I think this pandemic came at a terrible time, at least for our area of the country. I don't know about everybody else, but every time the trees start blossoming this time of year, what are the Bradford pears? It just kills me. And the symptoms appear to be quite similar to those that are for the pandemic. So they want to make sure that they're not using improperly the limited number of kits that they have. So let's separate the allergies from the people that are really sick. So if you don't have a fever but you're coughing, that's different than have a fever, coughing, and presenting all the other symptoms. So what we're trying to do is make sure that we're using the limited number of kits that they have. And by we, I mean the health department is using those appropriately.
Okay. Here's a question about city workers. What are we doing to protect our city workers during this virus that's going around?
Well, Gerald's got a pretty good plan.
Yeah, that's a great question. As we spoke about just a while ago, we've closed several facilities. That's a step that protects the employees from the public and the public from the employees. Additionally, we're following CDC and State Department of Health guidelines, encouraging and mandating folks wash their hands frequently. Folks avoid touching their eyes, nose, mouth, those standards things, and maintain the social distancing. We have recently been looking at, put out a city manager directive today, 2 of them actually, about how supervisors and employees can handle leave during this time. And so we're doing those kind of things, trying to factor in the social distancing aspect and working in buildings that at least we're taking the public aspect out of it. And so I think that's certainly a good start. As we look at what recommendations come out to us in the future on how better to protect our workforce and the public, we'll certainly be looking to implement those as fast as possible.
Okay. There's a similar question concerning that. It's saying what is being done to protect the officers in particular and the inmates in the county jail.
I know that the officers in public safety, Chief O'Rourke and Chief Jackson, have late last week, I think, had issued, or earlier had issued guidance to their officers and their firefighters on how to handle first responder conditions. And I know those are changing frequently as the whole situation creates. But I know specifically thinking about police officers, they have disinfectant in their vehicles and they have wipes. And at the police station itself, there's limited interaction with the public. There's a lobby that is cordoned off. Because of the nature of public safety and police work in general, they may need to take some suspects or witnesses back into an area, but they're going to focus that on a secure area that they clean frequently. So that's some of the things that they're doing. I know at the fire department, they're making sure with the EMS system that they're needed for call-outs, and then they're also getting notified if folks exhibit these types of symptoms that we've talked about, the cough, the tightening of the chest, COVID-19 issues, so that they can take proper precautions with PPE. So those are the things that I'm aware that we're doing already. There's probably more. So you talked about having some guests. Maybe we'll bring Chief O'Rourke and Chief Jackson on very soon and let them talk about that, because they can answer those questions better than I.
Yep. Okay, that's a good idea.
There is a question about curfew. Will the city implement a citywide curfew?
Well, I don't see that we envision doing that at this point. Right now, the issue is trying to keep people in smaller groups to prevent the spread of the disease, but it doesn't happen more after midnight than it does before midnight, so curfew doesn't really make sense to me right now for that. If there were a need for that in the future, we might look at that, but I don't see that as a problem.
Absolutely,
right now.
And I would just add that I've seen lots of stores changing their hours, limiting their hours, and I think that's a good approach as well to allow some of those things that people need for them to be able to get, but we don't probably need anybody to be open 24 hours nowadays, and so a lot of the chains in particular, the Walmarts and others, have adjusted hours.
Yeah, and I really appreciate the fact that some of those businesses are actually encouraging early hours for some of the older shoppers so they can get in and get out earlier before they get full up business going.
Good
So I
point.
appreciate the point that the fact that they're doing that to try and help out our citizens too. It's everybody in the community trying to do their part to limit the spread of the virus. So I appreciate all the things that people are doing.
Okay. There's a question that says, it's talking about hospitalization. Is the city prepared for usage of other buildings or what have you if the hospitals are overutilized?
Well,
The area.
there's not a specific plan for buildings to be used for hospitalization. However, in working with the hospitals, we're open to helping them any way we can. In fact, we'll be visiting with them again soon, both Integris and St. Mary's. And I know our emergency management director, Mike Konigsberg, who we need to have on here, visits frequently with them, if not daily. So we're attuned to, if they need something from us, we're going to provide it. And certainly we'll probably get more proactive over time because this ties back into the testing, it ties back into the precautions. If everybody takes it, the idea is, and part of the plan is, that by staying home and avoiding social gatherings of more than 10, we're limiting our exposure. So therefore we're limiting the strain on the hospital system, which goes back to testing.
Right.
And yes, it'd be great if the tests were available, but the Department of Health guidelines say that 80% of the people are going to experience, that get this, are going to experience mild symptoms, and they would be told to do the same thing as if they were positive. Stay home, drink water, take over-the-shelf medications like you would for the flu, and if it gets worse, call your provider again, and they'll direct you to wherever you need to go. So there's not current plans for any city buildings to become hospital units or beds. But that's the best update I can give
no,
now.
that's right. Yep.
Okay. Those are the questions that I have. I don't have any that are online. So is there anything else you guys want to just add to any other points you would like to make?
I'd like to encourage people, when these kind of things happen, the tendency is, oh, I need to make sure I get enough of this and I got to fill up. Go ahead and make sure you have food in your pantry and that you're ready. But I would encourage people not to try and empty the shelves of every product that they have. You don't need a 100-year supply of food. And what it does is deny that to other people that also need it. Particularly cleaning supplies, things like that. We're all concerned about having the right kind of cleaning surfaces and things sanitized and a healthy environment for our families. But let's take what we need or buy what we need. Buy what we need and leave some on the shelf for others too. Because if you have all of it in your house and nobody else can use it, the disease is going to spread because it spreads from person to person. So let's not get into any kind of hoarding. Buy what you need, leave the rest for somebody else. Particularly true of medical supplies, things as simple as like the face masks. We have a lot of medical providers out there that need those, so don't buy 1,000 pack because it's cheaper and deny the hospitals the chance to be able to get to those. So let's make sure that we're doing things responsibly. There are many websites that are out there, and we've shown a couple of those, I think, as we were airing, and we'll show some more as time goes on. But to be able to see what the Department of Public Health has, the Health Service has, there are several sites that are out there, and we're going to have a list of those as we're talking here. But
Absolutely. I was just going to let everybody know, because I know a question we had yesterday, I think, was about the supply chain and logistics, similar. I talked to Gerald Blevins this morning. He owns the Jumbo's chain here in town that has several stores, and I appreciated, visiting with him. He said that we really don't have a shortage of food. We have certain items, toilet paper, obviously everybody's well aware of, and I noticed in some cases dairy products, maybe eggs. But he said those are all in the pipeline. Even toilet paper, he said, is in the pipeline. The warehouse he deals with, he says that the staff is working 6 days a week, and they're paying overtime. So that goes with the mayor's message about when there are supplies, take what you need right now and know that there's going to be more coming.
Right.
And at every level, the presidential, the state, and the local level. And I was glad to hear that from our local hometown grocer, Jerald Blevins, today. So I wanted to share that with our viewership.
Okay.
And then I guess one other question that I don't know that we hit that I know is important to people. We've had questions about utilities and what we're going to do with utilities. To be frank, what we've done is this week we have not processed our cutoff list. That doesn't mean that we're not going to send out cutoff list in the future, and it doesn't mean that you're not going to owe for your water bills. But as we said yesterday, we're going to, and we always do, but even more so probably in these trying times, we're going to work with customers that have problems being able to pay their bill, particularly due to issues caused by the COVID-19 issue. So please call us. I think we have numbers that we've put out. We have numbers on the doors at City Hall if you come up there. And if you have an issue, please reach out to somebody and call me if you need to, but I don't think you'll need to because we have the utility department. And so I want everybody to know we're working with you. The cutoff notices people have gotten now, our system is really, you don't even get a cutoff notice till you're about 2.5 months behind. So I know that's important to people, so I wanted to share that this morning.
Jerald and I are meeting at least once a week with several community leaders in town, including both the hospital administrators here, including the Garfield County Health Department, the county sheriff, county emergency management personnel. So we're meeting on a frequent basis to continually evaluate what's going on and keeping each other in the loop, making sure the message that we all put out is consistent with each other, and trying to share the information we have so we can all benefit from it. So we encourage any questions that constituents may have. Please provide them to us. If we don't have the answers right away, it's certainly information that we want to bring to that forum to be able to get the experts to provide an answer for. So if anybody's got any suggestions about who they think might help us on this panel to be able to answer questions, we would be more than happy to accept those suggestions and involve them as well.
I think your idea would be great to have somebody from the health department here to help address concerns.
Yep.
Well, we want to thank everyone for joining us. We want to thank you, Mayor, and
thank you, Derek, and the team.
And we want to thank the audience, and we'll be updating you more, and we'll try to do more of these at least Monday through Friday. And if there's an emergency, we will come and do one on the weekends.
Right.
So we'll see you next time.
Alrighty.